Good morning, I am Dr. Jess, Department of Oral Medicine and Radiology, Anu Dental College and Hospital in Victoria. Today's session is on photodynamic therapy. Photodynamic therapy is also known as photochemotherapy, photoradiation, phototherapy. In this, there is an association of light and chemicals to treat various skin diseases which can also be used in oral cavity also. This is a modification of PUVA therapy which includes Zoralens and long wavelength UVA radiation. Photodynamic therapy includes a photosensitizer, light, and it is in the presence of oxygen-free radicals. Photodynamic therapy is defined as a photochemical reaction used to selectively destroy tissues by a two-stage technique in which the use of topical or systemic sensitizing drug is followed by visible light radiation. It is discovered by Oscar Raab, but it is used in medical field by means of Hermann von Tappenier. And it was first discovered by the rapid death of this protozoan, that is paramecium chordatum, by the exposure of light in the presence of a chemical known as acridine. Presence of light is modified the effect of the dye led to the identification of photosensitizer, and then they discovered that the presence of oxygen was necessary for the reaction to occur, and thereby they created this term photodynamic therapy. In 1907, they published a book, Oxygen-Dependent Photosensitizing Process for the Treatment of Skin Tumors and the Destruction of Infectious Particles, and in 1960, they discovered hematoporphyrin derivatives, and 1990 they used the topical aminolevulinic acid as a photosensitizer. What are the ideal characteristics of photosensitizer? They have to have a chemical purity, ability to target neoplastic tissue. There should be a short interval between administration of drug and peak of accumulation in tumor, short half-life, rapid elimination from the normal tissue, activation at wavelengths at which penetration in the target is very good, and ability to produce cytotoxic products. There are systemic photosensitizers as well as topical photosensitizers, and the important systemic photosensitizer is porphyrin sodium, and topical one is aminolevulinic acid and its methyl ester. Porphyrin sodium is usually given intravenously, and it is indicated in paroxysmal and lung cancer, but there are certain side effects also, that is photosensitivity reactions occurs and strictures can occur in the area where it is treated, but it is contraindicated in which tumor is invading into the blood vessels as well as porphyria. Topical photosensitizers. The first topical photosensitizer was aminolevulinic acid. And to overcome the energy-dependent process of transport of ALA across membrane, its methyl ester was discovered, and it was lipophilic, greater selectivity for neoplastic tissue. Aminolevulinic acid can be directly applied on the lesion. The major indication is actinic keratosis. There can be also side effects like photosensitivity, erythema, swelling, crusting, and itching. And the major contraindication is the allergy to this agent. Actually, aminolevulinic acid, it's derived from another photosensitizer known as protoporphyrin. Protoporphyrin 9 is synthesized locally by all nucleated cells and is detected in the epidermis within 3 to 8 hours after the administration of ALA. We have to use certain light source. So we have already discussed about the photosensitizers. So coming to the light source, that is, we can use broad spectrum lamps, diode lamps as well. Light source are two bands, that is Soret band and Q band. Range of maximum absorption of Soret band is 405 nanometer, and the Q band is lower peak of absorption like 510 nanometer, 540 nanometer. How do this act? This is act by means of reactive oxygen species. That is, by means of photodynamic therapy, there is oxidation of lipids, amino acids, proteins, and induces necrosis and apoptosis. That indirectly stimulates transcription and release of inflammatory mediators. It damages the plasma membranes and cell organelles. Alteration and permeability between intra and extracellular media happens, and inhibition of mitochondrial enzymes, and it results in cell death. What happens in tumor? In tumor, there would be, when you sensitize this chemical with light of appropriate wavelength, the tumor vasculature will get triggered, and also vessel constriction occurs, blood flow stasis and thrombus formation occurs by means of ROS or reactive oxygen species production, and thereby resulting in the necrosis of the tumor. We have to apply it by means of step-by-step procedure. First we have to clean the area, then we have to locate the area, then we have to apply this photosensitizer to the area, and we have to cover it for certain hours, and also we have to place that patient in a light source. Clinical indication: in journals it is used for actinic keratosis. Cure rate is 73% to 100%. 14 to 18 hours incubation period is needed. Basal cell carcinoma: patients can't undergo surgery, can given this photodynamic therapy. Lesions in the site where healing is hampered, and also in the elderly patients this can be given. Tumor thickness determines the response. More than 3 mm reduced response occurs. Success rate is 73 to 90%. It is very much helpful in superficial basal cell carcinoma as well as nodular basal cell carcinoma. It is used in aesthetic procedures like acne therapy. There will be photodestruction of propionibacterium and acne, and reduction in the size of the sebaceous gland, as well as decreased in the sebum production. In oral cavity, it is used for lichen planus, leukoplakia, and all other pre-malignant lesions. In lichen planus, the major photosensitizer used was methylene blue, and the absorption wavelength was at 620 to 690 nanometers. In periodontitis, we can use photosensitizers and photodynamic therapy. Periowave photosensitizer, it has got high affinity for bacterial cells in the periodontal pocket. What do you mean by PACT? Photodynamic antimicrobial chemotherapy. It uses antimicrobial property of photosensitizer mediated by singlet oxygen. It is indicated in periodontitis, periimplantitis, as well as endodontic treatment. Leukoplakia also, it gives a very good result. It causes superficial necrosis with no scarring. In leukoplakia, ALA-based photodynamic therapy proved good, and it has got good tolerance, less invasiveness, and low risk of toxicity. And there are certain pros and cons. What are the advantages? No long-term side effects when used properly. It is less invasive than surgery, done in outpatient basis, targeted very precisely, can be repeated many times at the same site if needed. No scarring after the site heals. It costs less than the other cancer treatments. It can't treat deeper lesions. Light can't travel far through the body tissues. It makes patients very sensitive for light. It is very much contraindicated if patients has got allergy. There are certain recent advances. A newer photosensitizer, photoglow, was added. That is, they may be able to treat tumors that are deeper under the skin or body tissues. They may be more selective for cancer cells as opposed to normal cells. They may collect in cancer cells more fast, and they may be removed from the body and reduce the time people need to worry about the photosensitivity reaction is less. So what do we conclude from this? Photodynamic therapy is a newer therapy. Randomized clinical trials are going on. It's not a first-line option, but a safe alternative treatment modality for pre-malignant lesions. Thank you so much.